Well, in other news now, the outbreak of respiratory illness among children in China has raised alarms. Questions are being asked: what could have led to the rise in respiratory infections in China? We've seen another illness from China wreak havoc globally. Is there another virus outbreak that's coming? The World Health Organization has raised concerns earlier over China reporting clusters of pneumonia in children. China's health ministry clarified this weekend that there is no new virus behind the surge in respiratory illnesses. What then could be behind the spike in the illnesses, that too affecting children? China says that the spike can be attributed to the flu and other pathogens that are doing the rounds. The health ministry says the cluster of respiratory infections have been caused by an overlap of common viruses such as influenza virus, rhinovirus and the respiratory syncytial virus, or the RSV. In the wake of the sudden rise in respiratory illnesses in China, India has asked different states and union territories to review the preparedness of their health infrastructure, while officials say the risk of a similar outbreak in the country is low. The Indian government has asked the state governments to review the availability of manpower, hospital beds, medicines, medical oxygen and necessary vaccines for influenza, all of this to deal with any potential health crisis. There has been an outbreak of the H9N2 cases, that is influenza cases, along the clusters of respiratory illnesses among children in northern China. Experts blame the same on the arrival of the winter and the end of the COVID curbs. Some analysts also say that part of the reason could be the lack of prior immunity among children in China. Remember, China had imposed one of the harshest lockdowns in the world to combat COVID. So Chinese residents may have developed natural immunity against the virus but have lacked immunity against other viruses.